Hello, everyone. How are you? I'm Melissa Simon. Really nice to meet you. I'm so glad you're taking this course. It's going to help you, hopefully, in some way, shape, or form for your next career step or step on your pathway towards a career. And perhaps it's a career in medicine or in healthcare of some way, shape, or form, or a career that touches health. As you have seen, there are many careers and jobs and internships and volunteer experiences that are related to health and healthcare. You can influence health from pretty much any field. So I'm really happy that you've started your journey with us. And I just want to review what we should be doing, or you should be doing with us this week. This is the middle of the second week. And if you haven't posted your assignment in terms of what health means to you, please do, because it's so fascinating to see the depth and the breadth of what health means to everyone around the world. You'll see some commonalities across, no matter where you live, and you'll see some unique meanings of health and visualizations of health. So please do post that. I think that's one of the funnest assignments that we have in this course, and very unique, and it helps. I learn a lot from each of your contributions. So thank you for my own education. We also have in this week's module 2, starting your healthcare career journey, we have knowing your strengths and all the different paths you'll take. It builds on a lot of what was learned in week 1, and it builds on things like the vocational courage lecture that you learned from Dr. Pierce in the first week, and the backstage pass and tour that you had with the RSA Animate video about all the different health-related careers. So hopefully you've seen those videos, and they've helped you in some way, shape, or form. And as always, we encourage your comments. So if you're a teacher or an educator or a student or an adult that just is interested in changing their career path, or just learning about these different career paths, please post your comments, because it will help us edit the videos or maybe add more resources if you're having questions or trouble about getting a little more granular about career paths. We'd really appreciate your input, because we do want to make this the best course it can be, and the best resource for you all. Finally, I want to emphasize that July 12th, so in a few days, the peer review is due, and that's really important, because it helps all of you who are taking this course help each other to improve your assignments. So please do participate. Very important. So we're going to go to the questions, and I will take the first question. It is, how many years must I stay in college to become a surgeon? If more than 5 years, are there any other ways to becoming a surgeon faster? So from the perspective of the United States education system, college degree can be 3 years if you're fast-tracked. It could be 4 years, which is the usual median number of years for a college degree. That's a bachelor's degree. And then some people take longer in college, 5 years, 6 years. So it really depends on the situation, but you do need an undergraduate degree, so a bachelor's in something. Now, there are some programs whereby medical school and the undergraduate degree are combined, so like a med prep program, as some programs are called in the United States, whereby instead of 8 years of total of 4 years of undergraduate and 4 years of medical school, it's a combined 7-year program. But there are other places around the world where you do an undergraduate, which is in medicine, and you go straight into a medical student curriculum and then on to residency training. So there really isn't a fast way of becoming a surgeon, because after you have completed your undergraduate degree and then medical school, which on average in the United States is 4 years for undergraduate, 4 years for medical school. You then have to go on to a residency program to train to be a surgeon. And that is usually about 5 years in residency training. And depending on the type of surgeon you want to be, that will dictate how many years in training you will be in. So for a general surgeon, you will have about 5 years in training beyond medical school. But if you want to get advanced training, thoracic surgery, breast surgery, plastics and reconstructive surgery, otolaryngology, all of those things usually require an extra fellowship. Especially if you want to subspecialize in more pediatric or children's children's surgery. So really it depends, but there's no fast track. There's no fast way. You have to go through many years of training to get to be a surgeon. And of course, there's gynecology, which is my field. I'm an obstetrician and gynecologist. And so that is 4-year residency training after medical school and after undergraduate as well. And if I wanted to do more specific gynecologic oncology surgery for women with cancer related to women's reproductive parts, such as ovarian cancer or uterine cancer, then that would be an extra 3 years in fellowship training beyond the 4 years of residency in obstetrics and gynecology. The next question, I'm really interested in working with lower income countries to achieve health equity in my medical career. Yay, just like me. What specialties are best suited to do this? So I assume that you are starting in a United States or a more industrialized country, and you said in your medical career. So I assume perhaps you're already in medicine, but let me take a step back. So personally, I went into medicine specifically to help people who came from an economic background like mine, very low income, low resourced, and didn't really see doctors around me other than me helping my own family through the medical system. So my orientation from the get-go was to use medicine, a career in medicine and career in healthcare, to help improve the health of everybody and to really help population health become equal for everyone, regardless of the resources or the background or the color or the language or fill in the blank, or any of the populations that don't necessarily have as strong a voice in the world. And so one way to do this is to go through medicine and take public health courses. Public health has a strong orientation towards trying to improve population health. And if we can't improve population health without making sure equity. And without health equity, you can't really improve population health broadly. So public health would be one way to do that. So specifically getting a master's in public health, there are different options within schools of public health or programs of public health to do things such as environmental health concentration or a maternal child health concentration or community health concentration. Or you could be if you're more of a numbers person, wants to use biostatistics to help improve population health through looking at numbers. You could do that. There's epidemiology to look at the causal factors and the determinants of health. Social epidemiology as well. There's bioinformatics and big data, whereby you could actually help improve the data that are being digested and analyzed and put that spin of health equity on. The other thing is in addition to getting advanced training in public health type courses, is to actually work with local organizations and communities that are doing work on the ground in terms of improving health equity. there's nothing better than getting firsthand experience, and you could volunteer. You could actually work in an organization that's doing the type of work that you're interested in. Those all help. Another way to do this is if you're in a hospital or a medical center that's more academic, you could, or if you know of people in a hospital or academic center that are doing this type of work and you're interested in it, people, usually these types of teams or labs are very open to having interns or volunteers, or there may even be a research position to be able to at least learn the ropes of what it's like to create a program on the ground and evaluate it. Because making sure that the programs that are on the ground to improve health equity are evaluated properly and actually changing and improving the health is really important. Next question, what is the biggest obstacle in becoming a top-notch medical professional? What are the best ways to overcome these obstacles when they cannot be avoided? So the biggest obstacle in becoming a top-notch medical professional, I would say, is sticking with it. You need to have the courage, you need to have the energy and the resilience to be able to keep climbing through each of the hoops. So you need to do well in your science classes, you need to do well as an undergraduate, you need to get into the next step of training. So whether that is, you say you're asking medical professional, I assume that could be a doctor, but it could be something else, it could be another healthcare professional. You need to get to that next level of training. So if it's medicine and you want to get a medical degree, your MD, then you would have to get into medical school, which is a very high bar. And that may take more than one application, more than 1 year. Some people have to apply 2 or 3 times. And in order to get into those types of schools, you also have to take standardized tests, such as the Medical College Admissions Test, the MCAT. And that can be very hard for people, and many have to take it more than once because it is such a difficult and challenging test. So having the resilience to be able to say, okay, I didn't do well this time, but I really believe that this is the pathway for me. And although I may not have done well this time, I've done well in my science classes. I believe this career aligns well with my passion and mission and goals in life, and I will try again. So being able to pick yourself up when you fall, and it's how you come up and try again, that's the most important part. And that goes for if you're applying towards a physician assistant school, PA school, or nursing, or social work, just having that vision and that goal in mind. But it also requires that you are a very good thinker and reflector, meaning you actually take the time to reflect on what happened. So if you didn't do well the first time around in a test or in a grade, or you were rejected from all the graduate schools that you applied for, you really need to stop and think, is this the right pathway? Am I running the right race? Is this right for me? Dr. Pierce does a great job in the 2 lectures that he gives during the tenure of this course, of the 6-week course, in helping you think through those questions that you should be asking yourself. So the best ways to overcome these obstacles when they cannot be avoided is really this reflection. So I strongly encourage that everybody take a few minutes every day. It doesn't have to be longer than 2 to 3 minutes. And sometimes it's just 1 minute. And think about what you did for the day and how you could tweak it and make it a little bit better. How could you have done better at studying, or better at writing a particular thing, or better at writing an email, or better at answering somebody's question or responding to somebody's question. It could be anything, but the better that you get at thinking about how you could be better at anything in general actually helps you become a better leader, a better student, a better doctor, or a better nurse, or a better whatever. Just fill in the blank. Some of the top leaders in business around the world take time to do this every single day. That's their secret. And it's free. Reflection is free. And it can happen at any time, while you're on the bus, while you're walking down the street, while you're on your bike, even while you're in the bathroom. So you can take a minute to do this. And that's what I highly recommend, regardless of the career you're going into. The next question: what advice do you have to someone who wants to make a career to the healthcare industry and has a family? Well, this work-life balance question is always at the forefront of what people ask me, because I have 4 little children, ages 10 and under, and there is never a good time to have a family. There's some better times than others, but you just keep going. Again, it comes back to, am I on the right path for my career? And is this the right journey for me? Does it match my values, goals, mission, passion in life? And if it does, then you're going to keep doing it, because if you love what you do, you're going to keep doing it regardless of having to stop what you're doing for the moment and go deal with a sick child or deal with chickenpox or some other disease that may come up. So that's the first step in terms of achieving what I would call a work-life balance, but I also don't really believe it's a balance, because a balance implies everything is equally attended to at all times, and that is totally not true. Something always gives a little bit, and then you have to remember, though, that later on you got to make up for it, right? So later on you'll balance it the other way in terms of work and life. What's really important, though, at the end of the day, is that you're happy in what I would call the 4 sectors of your life, right? There's your work, career, right? Your own self sphere, right? You have to attend to yourself. It's really important, whether you have family or other things. No one else, or no career or nothing will thrive without making sure that you yourself are healthy first and attended to. Third would be your family, and fourth would be your community, whether it's the religious groups that you affiliate with, your community organizations that you may volunteer or work with. It could be just your particular local village or city or community area that you work with and are committed to. It could be the schools that your kids go to. So those 4 things: your work, yourself, your family, and that includes extended family, and your community. And you have to really make sure that all of those spheres are attended to in some way, shape, or form. Obviously, understanding that within each of those at any one time, you may be attending to them a little bit less, and then later on go back. The other thing is it's really not about a balance. I think it's more about groove. If you mind me for a minute, it's about your own rhythm. Everybody's got their own rhythm. And it could be like a dance. Sometimes you're going to dance really, really quickly to some type of dance, and then other times you're going to slow down and dance slower, and sometimes you're not going to be dancing at all and you're going to walk. And those different rhythms at different times, it could be during the week or during one whole day, or during your whole life, you're going to be dancing to different rhythms. And it's about finding which rhythm is comfortable for you at that point in time. That is my spiel about work-life balance. Do you have any specific advice for balancing finances, family, and education? Well, specifically, everybody's got their price point and their finances. I think that's really important to understand is financial literacy. And there are programs online that can help you through different banks and locally in terms of building a budget for you. So whether you're a student or a high-achieving businesswoman or man or a physician or a nurse or a research assistant, it doesn't matter. Everybody has a budget that they should attend to. There are programs and scholarships and resources out there to help you create a budget, but also to help you achieve what you need to achieve within a budget. So if school for example, is a financial concern, then going to work with a particular financial aid counselor at a school is really important. And finding different opportunities for loans and the types of loans and the types of scholarships, and applying, and never giving up is really important for scholarships. So there's a lot of resources out there, and what it comes down to is the questions you have to ask, and making sure that you are actually brave enough, and I think brave is the right word, to ask, to not be afraid to ask, and not to be afraid to ask for help about building a budget. What price for a particular school is the right one for you, and how can you get help in terms of asking for financial support if that's what you need at any particular point in time. I'm redefining and in terms of family, asking help, counseling. I don't think, I actually know, as a physician, I see a lot of patients who would actually benefit from accessing counseling. You know, all of us at one point in our life could use some good outside advice, and just an ear that could listen, that has no particular relationship to us personally, a person who doesn't have a relationship to us, like a third party. I think not being afraid to ask for help when you might be struggling is a really important thing. And that goes back to understanding where you're at in your life and reflecting. So the next question is, I'm redefining myself and in the process of a career change at the age of 50. Good for you. That's awesome. The probability of employment decreases with age in any career field. Not necessarily. With a master's in computer science and a doctorate in management, what kind of career can I expect in healthcare with my limited experience in this industry? So I think that there's a wide gamut of possible career expectations. I think if you have a doctorate degree already in management and a master's in computer science, the question is what have you done with those degrees so far? What have you done in your 50-year career or 50-year life? And so it becomes reflecting and being able to package and market what you've done. So regardless of how old you are, we all have lived experiences. So I would argue even high school students have, especially high school students who have had to take care of their little siblings when their parents were working the third shift, for example, or have babysat for other people, for other kids. I mean, that, for example, gives good leadership skill and time management, because you've had to balance homework and maybe sports and working as a caregiver. If you've been on a team of any sort, whether it's a sports team or a team in terms of in industry or at a job, you've learned to be a good team player, hopefully, right? So that's another important characteristic. You've learned perhaps some hard specific skills on particular software packages, like Word or Excel or statistical software, for example, or PowerPoints. Communication skills have, I'm sure, been gathered across along the way. Relationships, building relationships, being a leader of a particular group or a team to get through particular projects. What kind of projects have you been able to pull off and lead, and what have been the impact of those particular projects? What's been the success? What are the metrics? What have you achieved over this career so far? So you really need to be able to first package what you've done, regardless of what level you're at. So that's the first piece of advice I would give in terms of you going back and changing your career. The other thing is what have you learned in those classes, and how have you applied what you've learned? In terms of computer science, have you created programs, or do you code? What are the kinds of jobs that are most attractive to you? You should be listing out what are the things that you want to do in your next step in your next career, as you put it. The other thing is I would look around and see who's in positions that you want to be in. Are they head managers of certain areas within the healthcare system? I would say there's a big need across many healthcare systems, even just in the United States, for people with strong management skills and with computer science background. So it really depends. You didn't give me enough detail in terms of what specific job that you would want, because the gamut of what could be open to you is pretty wide. But I would start with those things first. Feel free to post another question later on for another Google Hangout, and I'll respond. Another question is I'm interested in continuing to do research, but I'm not affiliated with any colleges or companies. I'm unemployed. How then do I conduct an institutional review board, or do I need one? So if you want to do research, the question, and you're not affiliated with a university or a college or a hospital or any particular company, the question is, what do you want to do research for? Is it so that you just want to do research to conduct research, or do you want to be employed? If you want to be employed, then there are lots of options out there in terms of industry and companies, advertisement agencies. There's all kinds of types of research. There's consumer research, and there's basic scientific research, there's community research, there's evaluation, program evaluation research. It's endless, the opportunity. So I think what I need is a little more information from your question to understand how best to guide you, because otherwise I'm just going to give you a very broad overview. You need an institutional review board approval for any research conducted on patients or on human subjects when you're within a particular company or hospital setting or university or college setting. In terms of just standing on the street and conducting a quick survey of yes, no, do you bike to work, wouldn't require an IRB, an institutional review board. So I need a little more specifics for your question to be able to understand more of what you want to do. And so there's another question. What advice would you give an international medical graduate that is applying for internal medicine residency to work on while constructing a personal statement and how to present oneself in interviews? It depends on where you're applying. I assume you're trying to apply for an internal medicine residency position in the United States. But if you're applying anywhere in the world for an internal medicine residency program, advice to construct a personal statement. I think personal statements are really hard. We have lectures, and we have in the third module of this course that talk about your personal story and really being able to craft and articulate who you are and where you've come from and why you want to do something in this world is remarkably important. And it's called your elevator pitch, your personal story. And so we have lectures and assignments in Module 3 that you should definitely look at it and work through, because some of my colleagues don't even do a good job of constructing their own personal story. And it requires a lot of reflection. Just like I mentioned in a few questions ago, being able to understand your own personal journey through life thus far and what drives you, what makes you tick, right? What makes you so excited to wake up every morning and go to work. That is what you need to articulate in a personal statement, and that's what's going to move people. Oftentimes, the better personal statements that I read as being on the admissions committee are stories. People connect what they've done or what they've experienced personally or through a family member or a loved one, and then articulate why that was the light bulb for them, why that moment just drove them into a field, and for your instance, in internal medicine. Why do you want to do internal medicine? Ask that question, why. And what have you gone through over life that has created the answer to your question why? I think that will help you extraordinarily. It's going to take a while. Usually personal statements are not written in an hour. They take days, and they may take weeks. I know that some of the ones that I've written for my own applications have taken weeks, and you have to be courageous enough to have other people read them. It's hard because it's a personal statement, so it's personal, but having other people read it, ask them if they were moved by it. Ask them if they felt like that you articulated why you want to be in internal medicine. In terms of interview, thank you for also asking that question. We do go over the most common interview questions on the interview trail in the module. In module 5. And so definitely go to those videos. Those will help you. Those common questions actually span pretty much every industry, whether you're going for an internal medicine residency interview or you're going for a job at a high functioning stock company. You really need to know your strengths, your weaknesses. You need to know why you want to do this particular job and what drives you, what motivates you. And you also have to be able to articulate the fun stuff. What is it that you do outside of work? Who are you as a person? You know, when you're not at work, what are you doing and why are you doing it? And who do you want to be in 5 and 10 years from now? What's your ideal dream goals? And what do you want to do with what the job is that you're applying for? Those are really important things, and you should practice that. You should practice answering those questions both first to a mirror or to your phone and video. You can videotape yourself so that you can see the eye contact you're making, your body position, what you're wearing, and just making sure that people feel comfortable with you when you are answering the questions. So definitely practice. And if you don't have somebody to practice with, definitely practice and videotape yourself if you can on your phone or your iPad or whatever it is, device, computer, or at least do it in a mirror. All right, next question. How can I get clinical experience for PA school if I don't have any certificate? I'm a senior biology student. So if you're a student in a college or in a university, oftentimes you can get connected by asking your teachers or a career counselor at your particular institution to help connect you to somebody in a clinic or who is working at a particular place that could give you a shadowing experience. Other ways to do it are go to your local hospital and sign up to be a volunteer. You can volunteer in the children's hospital or in a regular adult hospital, or even in a nursing home, and you can get some clinical experience in those ways. Other ways to do it, if you go to a particular doctor's office yourself, they may be able to hook you up with a temporary shadowing experience. So there's a lot of different ways to get some experience. Another way would be if there's a local PA school, you can always call them up and ask the admissions counselor for some ideas on how to gain clinical experience as well. And admissions directors receive all kinds of calls. So this is a perfectly appropriate question to ask. And you could say, call a local physician assistant school and say, look, I'm really interested in becoming a physician assistant and going to your school one day very soon. And I'm wondering if you have any opportunities or ideas for how I can obtain some clinical experience prior to going into the field or prior to going to school. Next question. I'd like to see videos of compliance officers, data analysts, healthcare informatics, information technology professionals, or C jobs. I'm not sure what a C job is. Uh, so I assume that you're asking me to expand the video repertoire in the video library, in the Keeping It Real video library. And so we can look to trying to find people to interview for those particular videos. We may even be able to find a compliance officer to do a Google Hangout with. Healthcare informatics, so Dr. Ko, Abel Ko, he does a lot. KHO, he's one of our in our video library, and he does some work, or actually he does a lot of work in healthcare informatics. So that's one person who we do have a video of. Next question. Can you please explain the peer review you mentioned at the beginning of the session, the one that is due next week? What is it, and where do we do it? It's about your career journey, and you follow the instructions for the assignment, and then you would submit it. And what happens is the computer program will assign you to doing assign you to reviewing someone else's assignment. And there's some specific criteria that you would answer in order to get through, like a rubric that you would answer in order to evaluate your peers' assignment. Hopefully that makes sense to you. The actual assignment itself is to reflect about your career goals. So you can, using the rubric that we provide for you to evaluate your peers, whatever peer that you're assigned, their assignment, that's how you would evaluate their career goals. The other part of that assignment is not only to reflect about your career goals, but about your plan to get to those particular goals. Because in this course, what we're really trying to do is, is get you to be a little more granular about how you would actually get to each step along your career path, or the career path that you think that you'd like to be on for the moment. So if there are any challenges to getting to a goal, so say for instance, you want to go to physician assistant school, and right now you're an undergraduate, and you're in a 4-year program, or you're in a 2-year program, and you know that you have to get to a 4-year program, so a 4-year undergraduate program. So you would have to first finish the first 2 years and do well, get your associate's degree, and then get into a 4-year program. And if one of your challenges, for instance, to get to a 4-year undergraduate program is cost, then you would want to work with your counselors at your associate's program and find and talk to directors of admissions of other programs that you're interested in going into that are the 4-year, to complete your 4-year degree. Then you would talk to those directors of admissions and ask what financial aid is available, and then scholarships that are available. And you would compare costs and value. And that's just one example of a career goal and a stated challenge. You also would have to, within this assignment is your 1-year goal, your 2-year goal, your 5-year goal, the steps to get there. And you can be as detailed as you want to be in this assignment, but as a peer reviewer of the assignment, you don't have to be as strict. We just ask that you look at your fellow peers' assignment to see if they've thought about this, and if there's a little more thinking that needs to go into which steps they need to get to the next step in their career, and what their potential barriers or obstacles within each of these steps would be. You can find the actual assignment if you're interested in trying to figure out where this assignment is. It would be under Module 2, and it's called Quest 2.2. So hopefully that answers your question, Gina. If not, post another one, please. Okay. I think this is the last question, I believe. You brushed on this some, but I have concerns about acceptance into medical school at my age now of 39. I have an AAS in network. a BS in computer science and was a year into grad school before I transferred to AAS RN that I finished this year. Okay, so age is not the barrier, and if it is, then that's discrimination. So in the United States of America, so I would not think right off the bat that age is the barrier to getting into medical school. And I'm just going to use medical school as an example. Same nursing and other professions. The issue more is what is your profile? What is your package? Who are you? What have you done in your 39 years of life? What have been your experiences, and what sets you apart from that stack of applications that may have other 39-year-olds or 45-year-olds or 25-year-olds in it, that have great grades in their science classes, great grades in other things, have done volunteer work, have done some research, have done some other interesting life experiences. What makes you so unique? What's going to stick out from that pile? Because we get piles of applications to medical school, for example. Even in nursing and in graduate school, et cetera, we get piles. And some schools get really, really high piles of applications, and some schools get a little bit more moderate levels of piles. And within these piles of applications, there are a lot of stellar applicants. And the question is what makes you stand out? And I would say you use age to your advantage, and you'd use your nursing degree to your advantage, and your computer science background to your advantage. So what I mean by that is, what are the things that you've done in your life that will make you unique? Did you code some certain app? You created an app, or you created something with your computer science background that just helped change the way a company functioned, or helped create a program that actually made people healthier, or it helped try to improve health, or try to improve health technology? Did you, with your nursing degree, go volunteer or work in a particular position for a particular period of time? Was any of the, say for a volunteer experience, did you do, what kind of contribution did you make, during your volunteer experience? What have you done over the last decade? What makes you unique? And that's really what's important. And of course, you have to have grades, and you have to do well on your MCAT scores for the medical school admissions. But you also have to make the case of what makes you unique, and where's that passion? Because on the application, when I read applications, I want to see that passion bounce off the page. So why? Why do you want to go to medical school would be my question. It's not whether or not I think you can make it, and it's not about your age at all. It's about why. And then you have to make that case and convince me why. And when you get an interview, you have to do the same thing, right? If anything, I think students who are more mature, regardless of their age, and who can talk in a very interesting way, and in a very educated and I would say unique way about their experience, and pull on experiences from across their lifespan, those are the conversations that I remember. And those are the conversations that help elevate your chances for acceptance into medical school. So hopefully that answered your question. Again, please feel free to pose more questions. Oh, here we go. Not a question, but a statement. Thank you for doing this. I am finding this course very useful. Thanks to you and everyone involved. Well, thank you. Thanks, Gita. I appreciate the compliment, but in all honesty, I want to keep making this better. It's hard to be granular and detailed for so many students. And so we're trying to make this as best a resource as possible. So it's up to you as students and as educators, because I know that there are teachers taking this course right now, and how they, so that they can see how they can help other students. And that's really what I want this to do, is to serve as a resource to help people get to their next step, and in any career, as a matter of fact. So thank you. A big thank you from me as well. Thank you. Great. Great. So some final thoughts. So I know this was the first Google Hangout for this class, and there are archive stuff, and you have lectures about who I am and where I've come from, and I think this course is genuinely, it came from my heart and my own passion. I've experienced firsthand the bumps, a lot of bumps and lumps along the way, and I think what's really important is that you all understand that it doesn't matter what kind of background you come from and how resourced it is or where in the world you come from. It's about your vision and your passion and your goals, and about understanding who you are and what makes you tick and what makes you function and what puts a smile on your face when you wake up in the morning, right? Is it caring for your family, or, you know, just caring for others? Or is it, you know, the ability to help somebody through a difficult math problem? What is it? And so the goal of this course is to provide resource, because I really believe that everybody should understand how to tell their personal story, how to write a professional email, how to create a resume and a cover letter, and how to interview and communicate and use their social network to their advantage, and to help, and to, not only to their advantage, but then to create good in the world and to help each other. So that really is why I created this course. And so I hope that you find, you know, even if it's just one lecture in this course that is useful to you, that you spread the word, because if this is not for my advantage of any form. This was a complete side job for me. It was not part of what I was charged with doing. I was not told you have to create a course. I do enough teaching and education at Northwestern, at the school that I work at, and I do enough patient care and research and other things. This really was to help everyone out there have some basic resource. So that toolkit that we have up for you is important. You know, if you all are searching through the internet and find a tool that you think would be great, please post it. Please tell us, because then we'll post it. Because this is about helping each other. We created a community of helpers that can then impart information to other people, because that's how we become stronger, both individually and collectively as a whole. The other thing is that career portfolio. Like, if you know somebody, like, first I want you all to create one and to make sure that you follow it, because that took a lot of work to build. That career portfolio is a really important resource, and it doesn't matter if you want to do a health care related field or health related field of any form. It's relevant to anything, any field. And if you know somebody who's struggling, it could be a parent, it could be anyone who's struggling trying to find a job, this is a good starting place. You don't have to go through this whole course. You can just log on, get that career portfolio, download it, and work through it. Or if you need somebody to help talk you through it, that's what these quests are designed for, and that's what the lectures are designed for. So I really think that I can't emphasize it enough, that please spread the word about this course and about what's in it, because there are some elements that apply to everyone regardless, not just for health careers. I see one more comment that's popped up, that just thank you. I see a lot of thank yous. So thank you for saying thank you. I appreciate it. That makes me that makes me happy that I did this. I see that inspiration and loving my story. So thank you. I appreciate it. So you all have a good day, and thanks for joining me. Talk to you soon. Bye.